Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I'm Nishaba, a certified medical coder. In this video, we will go over some important practice questions from the remaining digestive system along with guidance and quick elimination method. So you can choose the correct option within a minute. So without further ado, let's get started. A 20-year-old female is have to tonsillectomy performed for chronic tonsillitis and hypertrophied tonsils. A macular mouth gauge was put in place and the tongue was depressed. The nasopharynx was digitalized. No significant adenoid tissue was felt. The tonsils were then removed bilaterally by dissection. The ulva was a huge size because of edema. A part of this was removed and the raw surface of one with three chronic catgut. What CPT codes is are reported. Option A with code 42821, option B with code 42825, 42104 along with modifier 51. Option C with code 40826, 42106 along with modifier 51. Option D with code 42836. In the given scenario, tonsillectomy is performed. Always remember for tonsillectomy or endarterectomy, course selection is based on patient age and what was excised. Since this scenario involves only the removal of tonsils, we first eliminate option A with code 42821, which is used when both tonsillectomy and endarterectomy is performed. We also eliminate option D with code 42836, which is used when only endarterectomy is performed. In the next step, we eliminate option based on the patient age. In this scenario, the patient age is 15-year old. Therefore, we eliminate option B with code 42825, which is used when the tonsillectomy is performed on the patient of age younger than 12 years. So our correct option is option C with code 42826, which is used when tonsillectomy was performed on the patient age 12 or over. Additionally, since this scenario involved the excision or removal of alveolar edema with repair, we also use code 42106, which is used for the excision of the lesion of the palate or the alva with simple primary closure. Modifier 51 is added to indicate that multiple procedures were performed during the same surgical session. A 40-year-old woman with a 6-month history of right upper quadrant PET was diagnosed by ultrasound with multiple gallstones. She presented for gallbladder removal. In the operating room, after induction of general endotracheal anesthesia, the patient was prepped and wrapped in a sterile manner. A trocar was placed and carbon dioxide insufflation created adequate pneumoperitoneum. Laparoscopy revealed an enlarged, thickened gallbladder with signs of chronic inflammation. Two additional ports were inserted and grasper were used to dissect the gallbladder from the liver using sharp dissection and electrocautery. Due to limited exposure and difficulty in dissection, the procedure was converted to an open cholecystectomy. After removing the trocar, a midline incision was made. Multiple adhesions were found and carefully lysed. The gallbladder was then identified, the cystic duct ligated, and the gallbladder removed. The area was irrigated and a needle liver biopsy was performed. The incision was closed in layers. All counts were correct and the patients were transferred to recovery in good condition. What CPD codes is our report. Option A with code 47,600 along with modified 22. Option B with code 47,600 along with modified 22, 47,001. Option C with code 47,562, 47,600 along with modified 22, 47,001. Option D with code 47,562 along with modified 22, 47,000. In the given scenario, a cholecystectomy or the removal of the gallbladder was performed. The correct code is selected based on how the gallbladder was removed. Initially, a laparoscope approach was used as indicated by the use of trocar. However, due to the limited exposure and difficulty in dissection, the procedure was converted to an open procedure. An important point to remember: when a laparoscopic procedure is converted to an open procedure, we always report the code for an open procedure on the not both. Based on this, we first eliminate option C and D with code 47562 used for laparoscopic cholecystectomy. In the remaining two options, CPT code 47600 is used for open cholecystectomy. In this scenario, a needle liver biopsy was also performed in addition to gallbladder removal. Therefore, the correct option is option B with code 47600 used for open cholecystectomy. Modifier 22 is used to indicate that extra time and effort were required due to complication during the procedure. Add-on code for 7001 is used when needle biopsy of the liver is performed in addition to the primary procedure. A 42-year-old man has a lesion on his pancreas. The physician passes the biopsy needle through the skin and removes tissue to be sent to the pathology. Fluoroscopic guidance is used to obtain the biopsy. Physician's report and the interpretation is placed in the record. Got this encounter. Option A with code 48,100, 77,002 along with modified 26. Option B with code 48,102, 77,002 along with modified 26. Option C with code 48,120, 76,942 along with modified 26. Option D with code 48,102, 76,942 along with modified 26. The given scenario involves a biopsy of the lesion in the pancreas. Based on the type of the procedure performed, we first eliminate option D with code 48,120, which is used for the excision of the pancreatic lesion, not a biopsy. In the remaining three options, code 48,100 and 48,102 are used for pancreatic biopsies. The correct codes depends on how the biopsy was performed. Since in the scenario the physician passes the biopsy needle through the skin, it means percutaneous needle biopsy was performed. Therefore, we eliminate option A with code 48,100, which is used for an open biopsy. From the remaining choices, we choose the correct option based on the type of the imaging guidance used. Since the biopsy was performed under fluoroscopic guidance, the correct answer is option B with code 48,102 and 77,002 along with modifier 26. A 60-year-old male with a body mass index of 45 has uncontrolled diabetes and hypertension. Following non-operative obesity intervention and decision has been made to perform gastric banding. A laparoscope along with an 4 to 6 trocar ports are sited through the anterior abdominal wall above the umbilicus. The silicone gastric band is placed and secured around the upper stomach to form the smaller stomach pouch with a narrowed outlet. Tubing is attached to the band and tunneled through the abdominal wall, connecting it to the access port. What CPT code should be used for this procedure? Option A with code 40,634, option B with code 40,645, option C with code 40,770, option D with code 40,848. In the given scenario, gastric banding is performed around the upper part of the stomach to create a smaller stomach pouch with a narrowed outlet. It indicates gastric restrictive procedure was performed. Since the procedure was done laparoscopically, we first eliminate option A with code 40,634, which is used for an open procedure. We also eliminate option B with code 40,645 because it is used for the gastric restrictive procedure with gastric bypass, which is not the case in this scenario. We also eliminate option C with code 40,848, which is used when the provider modifies the size of previously created stomach pouch during a gastric restrictive procedure. However, in this scenario, gastric banding is performed for the first time, not a revision or adjustment. Therefore, the correct option is option D with code 48,770, which is used for laparoscopic placement of an adjustable gastric restrictive device like gastric band and subcutaneous port components. What CPT coding is reported when physician makes two separate incisions to perform laparoscopic appendectomy and laparoscopic cholecystectomy. Option A with code 44,960, 47,562. Option B with code 47,562, 44,970 along with modified 51. Option C with code 47,562. Option D with code 47,562, 44,970 along with modified 59. In the given scenario, the physician makes two separate incisions to perform a laparoscopic appendectomy and laparoscopic cholecystectomy. Since the appendix was removed laparoscopically, we first eliminate option A with code 44,960, which is used for an open appendectomy. We also eliminate option C, which include code only for the laparoscopic cholecystectomy and does not account for the appendectomy. From the remaining two options, we select the correct code based on the use of the modifier when two procedures are performed during the same operative session. Since the physician made two separate laparoscopic incisions to remove the gallbladder and the appendix, we indicate this by appending Modify 59 to the second procedure code. Modify 59 show that the procedure were distinct and separately performed even though they are occurred during the same surgical session. So correct option is option D with code for 7,562 and 44,970 along with modifier 59. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.